Greetings, greetings. Today we're
Hello.
gonna. Oh, sorry, Bob. Today we're gonna talk about common elbow pain like tennis elbow,
or
golfer's elbow. That's the common name. You can call them medial or lateral epicondylitis, the technical name.
Or you can swear 'em.
Or what?
Swear 'em.
Swim.
Swear at 'em.
Swear at them. Curse. Yeah.
Ah.
Anyways, we're going to show you some at-home treatments. There's 3 easy ones that work very well. You can do them simply, and you've got 9.3 seconds. We'll get right at it. Thank you very much.
Bob and Brad, the 2 most famous physical therapists on the internet.
Okay, once you realize you have one of these terrible elbow pain diagnoses,
it's bad.
Yeah, it's not going to tear you apart, but it's going to change how you function with your life,
Right.
depending on what you do. Let's say we have tennis elbow
Tennis
here.
elbow.
It doesn't matter. First of all, avoid activities that irritate it. You'll know
Right.
because it's going to make you say, "Ow, boy, that hurt!" Like opening a doorknob or some activities.
Lifting a tray.
Yep, exactly. Then also use NSAIDs if that works for you. Ibuprofen, Advil, whatever it may
An
be.
anti-inflammatory.
Yep, exactly. And a cold pack can work wonders at the end of the day or whenever. Get a cold pack on there.
That's the Bob and Red pump.
It is.
Cold pack.
Yeah, we've got
It
out.
comes with a strap.
Yep, these are real nice. They're soft on one side. They do not freeze hard, which is
Right.
we would not recommend one that's not of top
High
quality.
quality.
That's right. You can also take a cup and freeze it
Right.
3/4 full of water, a paper or styrofoam cup. Tear apart the top and then go direct ice on that for
Right.
5 minutes. That's a little more aggressive. And that you have to kind of be ready for.
Fast though.
Yeah, it is. All right, now we're going to go on to the treatments. Hold on. All right, the first one we're going to do what's known as a strain counter strain technique. And what we're going to do, Bob is going to do the golfers. If you have pain
Right.
on the inside, and if it's out here, the tennis elbow, I will demonstrate that. They're almost identical. You just change the direction of the hand.
Right.
So for tennis elbow, it hurts back here. You're going to bring your hand and wrist back that direction towards it, towards the
Put
pain.
it on slack.
Yes, exactly.
Muscles.
Yep. But you do flex the arm. Notice we have pillows because you want to completely relax the arm.
Be comfortable.
Yep, and the shoulder. Doing this on a recliner with some pillows is ideal.
Sure.
Or lying down in a bed works very well too. You can find that tender spot, push on it, and say, "Ow, that hurts right there." So that's kind of getting your benchmark pain level. So you say, "Oh, that hurts at about an 8/10." Then we're going to flex, extend. If it's golfers, you're going to flex the elbow and flex the wrist.
Down this way.
And this is done in a quiet, relaxed atmosphere. You're not going to do it with TV on or kids running around, that type of thing.
And then you add rotation. right?
Yes, yep. And only you know where it is. You're not going to
Right.
have a therapist.
Because it feel better.
Yes. So I've done this a number of times with tennis elbows successfully. And you'll rotate it this way or that way, whichever way the pain drops down. You should be able to get it down like to 1 or even 0.
Right.
And then this is the hardest part about the whole technique is once you find the comfort spot, be very relaxed, and you do have to time it. You have to go a minimum of 90 seconds and holding.
Which is a minute and a half.
Yes.
Or up to 2 minutes,
Yep,
right?
90 seconds to 120 seconds, and it has to be at least 90 or it will not be effective, according to the
Now,
research.
Brad, I have to be honest. I was a skeptic of this
Yep.
technique, but it works.
Yeah, I was the same way, and I was grateful for it. And then once you're done holding it, you do not go to an aggressive activity.
Right.
Actually, you're going to straighten
Ease
things
out of it.
Yep, slowly. Kind of work things around slowly. And then you're going to go back to that painful spot, and then you're going to reassess how tender it is. Now, I was at an 8. Now, I've done this real life. I've worked with patients with this. It's not uncommon to go from an 8 when you're touching it down to a 1 or a 2.
Sure.
And you did very well then. You can massage the muscles
And
around
how
it.
often a day?
2 or 3 times a day.
Sure.
And as it gets better, you'll you'll notice that you'll just do it less, and you won't even think about it
Right.
as much. And you can continue with Copex and ibuprofen as you feel, but it's a really good technique. I think that's why I put it on number 1.
All right.
Let's go to number 2, Bob.
Very good.
All right, this next technique is kind of like massaging it, but it's called the Graston Technique. Don't worry about that, but you can just take a butter knife. We're going to use the handle of the knife, not the
the
sharper
blade.
end. Yeah, and
Right.
not that a butter knife is sharp, but we're not going to use that. Now, here we have, and it doesn't matter if you have tennis elbow, if it's on inside or outside, the technique's the same except for you do it in the area of pain. So this mark is the tender spot. So if this was Bob with tennis elbow, when I push, yeah, he would go, ow, 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 and I'd say, be quiet, you wimp. No, I wouldn't do that. I'd say, now, Bob, this is what we're going to do. We're going to take some lubricant. It can be any kind of moisturizing cream. We're using actually
Cowabunga cream.
Cowabunga. So actually, this actually helps with pain as
Right.
well. But you anything to lubricate it, you can put that on there and use it liberally. Don't be too. There you go. Bob's going to rub it around. And that's just for lubrication as Bob starts to do I'll call it scraping, if you will. Are you ready, Bob?
Yep. I'm using the handle.
Yep.
I'm going to shovel,
Right.
not rake.
Right. So he's referring to the angle
Of the blade.
Of the butter
not
knife.
the blade, the handle.
The handle, yep. You can buy Graston tools online. They cost $10, $20. They work a little better than a butter knife, but I've used these and I've had good luck with them.
Right.
So it's up to you on that point. But you're going to do this for 2 to 3 minutes. It takes a while. And what you're going to notice is you're not going to go up into the painful area. You're going to go just below it. The muscles go this way, so that's why Bob's going away. He's not going to take it up towards his shoulder.
And they could get reddened.
Yes,
The skin.
and that's okay. You can once your skin starts to turn red, you know you're getting more blood flow. The muscles is relaxed from the massage aspect of it, and then you'll stop, and then you'll take and simply wipe off the excess, like that, and you can do this daily.
Sure.
Make sure after the first time you do it, though, you wait 24 hours just to see
See
if
how he reacted.
sometimes people overdo it and they get bruising.
Right.
That's okay. It should go away. If it doesn't go away, then you shouldn't continue to
Right.
do it. That means you just give it some time, and it's just some ecchymosis, old blood that your body will absorb. So that's our second one. We're going to go on to our third option. Okay, here we go. Number 3. There's 2 options to do this. It's a cross friction massage. We've been talking about this for years. Bob is going to show the manual way to do it.
Okay, you could go finger by finger or finger on top of finger.
Yeah,
So you're not going to hit right on the spot.
right.
It's too tender. So I'm going to go a little bit off the spot, and I'm across the fibers
Yes.
like this. And I'm going to rub pretty strongly.
Yep. Getting into that muscle.
Right. Arm relaxed.
I actually do mine with 3 fingers, and that's up to you. 2 fingers,
would.
3. Well, yeah. I don't know. I feel better that way for whatever reason. But
And
yeah,
I
and
can work my way down.
How long are they gonna do this, Bob?
Well, you could go up to 5 minutes.
Yeah.
If you can tolerate.
Yeah, because your fingers are gonna
Right,
be the
get tired. Right.
problem. Yeah.
The weakest link.
Yeah. If it happens, you're doing this, and after a minute or so, it just feels like it's getting more and more sore, then you should stop.
Yeah.
Uh,
It should feel better after 30 seconds or
Yep.
so.
Yep, should feel kind of numbish or just feels good. Then you know you're doing okay.
The
with
right
it.
thing.
Or you're just being too aggressive.
Right.
Yep.
What's the other option, Brad?
Well, if you don't want to wear your fingers out and you happen to have a massage gun, on this I highly recommend one with a round ball like this. See that? They come in and out very easily. This gun happens to be
The
a giveaway.
EM19, right.
Yeah.
And it's this week's giveaway.
There you go. But you use whatever massage gun you have, but the round head works good. You're not going to go straight in to this. That's too aggressive. You're going to want to go sideways and get that same, because you need a gun that reciprocates like this.
Across the fibers.
Yep, across the fibers. And it's amazing how well you can control the intensity by going sideways and working that.
And poor Brad doesn't get tired.
Ow, oh, whoa, there we go. What happened was I got my skin in there. I had it.
Oh,
I didn't have the gun. I didn't have
At the right angle?
Yep, that was the wrong angle. Figured it out very quickly.
Now, the thing about buying a gun, you can use it anywhere. So
Absolutely. You can put it in your quadriceps, your hamstrings, your calves. Not your neck, though.
Not neck, right? Or head.
Yep. To get that
chest.
pectoralis major muscle. Yeah, they're very much used all over the
They're
place.
handy.
Yeah, handy. Get it? You
Yeah.
with your hand.
All right.
Anyways.
Got
All right,
it,
very
got it.
good. That's the 3 techniques. You're going to have success with at least one of these. And probably the first one was I'd go to first.
And peace and love to you.
There you go. Wow, Bob. Maybe we'll do a sermon next.
Sounds good.